Hi, welcome again. This is Dr. Oscar Hernandez, board-certified internist and pediatrician. We're putting together a series of short videos about some of the questions that my patients have and that I get asked about most commonly when it comes to the issue of coronavirus. We did a short segment very briefly, not long ago, about how to disinfect, sanitize, sterilize our N95 or other masks that we may be wearing to protect ourselves or the general public. And there's a great deal of disinformation about this, so I'm going to deal with it again. This is part 2 of how to take care of your mask. To begin with, we don't sterilize these masks. So if you have the idea that you're going to sterilize a mask and that it'll be free of every single germ, virus, disease, forget it. It's not going to happen. Don't even shoot for that. We want to keep our masks clean, but we don't want to be rubbing them with soap and water. That can disintegrate most masks that I see, whether they're N95 or the surgical masks that are pleated. So we need to understand and know the difference. And then what we want to do really is to disinfect these masks. Now, this talk is not meant for hospital workers, hospital employees, people that are working in an area where there's a COVID-19 unit and they're there face-to-face with all these affected patients. Those people have to follow different protocols. My video has to do with the day in, day out mom and pop who go to the grocery store or who go to pump gas or wind up going outside the home for some reason and they need to use a mask. Remember, the only mask that protects you, the only face covering that protects you from getting coronavirus is the N95 mask, properly fitted. We're going to talk to you about what proper fitting means in just a moment. That's not the point of the chat, but we got to talk about it. So these face coverings and things that are out there that people have been advised to wear, the surgical pleated masks, useful, again, we've said this before, I'm going to say it again, to prevent people from spreading the virus should they have it. Now, let's assume you have a pleated surgical mask or an N95 mask and you want to clean it. My wife came to me the other day showing me this device that they were selling online that uses ultraviolet waves to clean stuff. Well, it's a good idea, and ultraviolet waves are being used to clean these masks on a large-scale basis in hospitals and in certain clinical settings. Specifically, the University of Nebraska, they were using 254 nanometer ultraviolet light tubes, 8 of them in a specific room with certain spacing between masks for a certain amount of time, for a certain amount of millijoule exposure. These are 300 millijoule exposures over 15 minutes. Let me ask you something. That thing that you're buying online, if you're doing this, or that ultraviolet light that you're shining on your mask or on your hands or whatever, do you know how many millijoules it's delivering? How long you should keep it there for? Do you know how many tubes it's using or what the wavelengths are that are being used? No, you don't know any of that. Let me tell you why I'm against these kinds of things. They may be good if you're trying to sell a product and make a buck, but at the end of the day, this detracts from the important thing: the hand washing, the sneezing, the social distancing, all these things, and then we depend on some ultraviolet system that isn't proven, that is some homegrown remedy that was made to clean jewelry or sanitize earrings or something else, or CPAP face masks or whatever. Those units are out there. They may be good for that. We don't know that they're good for this, and in fact, the systems that we do know work for this are not available to the general public. I've had feedback about cleaning these masks and the use of the Lysol spray that I recommended on my last video. That Lysol spray has about 40% alcohol, and we know that taking your N95 or surgical mask and dipping it in a pool of alcohol degrades the mask. We know that. That's very different than spraying a little Lysol on it. Is there a study that spraying Lysol disinfectant at a distance, not bathing the mask, but using a few short bursts as I showed, is there evidence that that degrades the mask? No. Is there evidence that it sanitizes the mask completely? No. But listen, we're in uncharted waters. You know what does sanitize the mask? Systems that are not available to us. For example, the FDA cleared 2 systems, one by Battelle and the other one by Steris, to be used in hospital settings. These are like truck systems that you bring to a place, and you load thousands of masks, and you put them in there, and the system can clean all these masks and disinfect them quickly. Well, that's not accessible to you or me. I'm a physician in the trenches. I don't have access to that kind of stuff. You probably don't have either, but you probably have access to a little can of Lysol spray. So it's important not to go crazy with all of this stuff. So there's also some information out there about boiling masks. It sounds good. The recommendations are from a Dr. Tsai, Tsai, the fellow who apparently developed the N95 mask. That's what the articles that I've reviewed said, but I'm not sure that he alone was responsible for that. It's probably a team effort at 3M or some other place. I don't know for sure. But the point is this: boiling the mask may also be useful, and there are some videos about this. However, if your mask has a paper or cotton type of liner in it, it may disintegrate the mask. So you have to know what type of mask you have, and most people don't know what type of mask they have. So much for the boiling part. How about putting it in the oven? The recommendation there is 160 Fahrenheit for 30 minutes. I don't know how many times you can do that to a mask, and it's not going to start to disintegrate. There are some recommendations out there. Now, Duke University has also developed a system where they used vaporized hydrogen peroxide. And I've heard of hydrogen peroxide being used to disinfect these masks and sanitize them a bit at home. Here's the problem. The Duke University protocol used an H2O2, a hydrogen peroxide, vaporization room at a certain temperature for a certain time, at a certain pressure. We don't have access to that. So my advice: stick to the little Lysol can. Don't bathe your mask in this stuff. Just put a few squirts in it the way I showed you. Is it 100%? Probably not. I'll tell you what, ever since I started using that, my mask sure does smell a whole lot better the day after I take it out of the bag and use it. I'm not talking about taking some mask, sopping wet with Lysol and putting it on your face. And remember, if you have some kind of an issue with allergies to Lysol or those types of things and your skin starts to break down, don't do that. In a wonderful world, in a perfect world, we would change these masks every time we had a patient encounter. We know, and we've discussed, that that's not realistic. So that's this video, part 2 of mask sanitation and cleaning. Just know that there's a lot of stuff out there that really isn't proven, that is touted, I believe, to be more than what it really is. And remember, if your mask is broken, if it's ripped, if it's got a hole in it, if it's got debris on it, then find another mask. That's not the type of cleaning and disinfecting that I'm talking about. Okay, so I'm going to talk about the latex glove thing. And now I want to talk to you a little bit about latex gloves. Now, here's the thing. You know from videos that we've done that I use latex gloves in the office when I'm going to be in direct contact with a patient that I believe needs to be tended to because we think that they have coronavirus, and I'm going to go test them, and I dress up in my astronaut suit, and I go outside and we do the test that has to be done. But I'm seeing more and more people wearing little blue gloves at work, or latex gloves of whatever color they have, and they're wearing them at work. And they're wearing them to answer the phone, and they're wearing them to go outside and to go to the Home Depot and to touch things. It sounds good. I'm protecting my hands. But let me tell you the problem I have with that. It distracts us from the real thing that we know helps decrease transmission, and it's not gloves in that type of a setting. It's hand sanitation. The hand washing, the hand sanitizer, the having the presence of mind to do that multiple times a day, especially when you have been touching something in the public setting. Not so much something in your home or in your car, unless your car is infected, hopefully not, or your children or household items. This has to do with going outside, maybe grabbing a gas pump, putting your credit card into a scanner, putting numbers into a keypad at the local pharmacy where you go to do things. Then it may be a different thing to wear gloves. And by the way, you know what I use and what I encourage people to use? If you're going to the market and you're getting those little plastic bags that are ubiquitous and everywhere, these things that we come out of the market with our stuff in, those make great little things that we can put our hands in. I have been able to sign pads at a checkout counter when I'm using my card through that particular nylon. I've been able to press keys on a credit card machine when I'm doing that. So using those keeps us from overusing the glove supply that other people like me and other physicians, people in the trenches, need. So who should be wearing a glove? Probably nobody. unless you're in direct contact with a patient. Use a bag from the grocery store if you're going to use that. And remember, if you've got a glove on and you're touching this and that and the other thing, well, you might feel protected, but assuming you have virus on that glove, you're spreading it everywhere. So here's a great idea. We return to the point of initial contact. Sanitize your surfaces frequently. At work, we advise our workers twice a day, sanitize surfaces. That means that they take out all their cleaning products, they clean the counters, their keyboards, their phone, their cell phones they may have used, their keys, all those things. And gloves distract from the presence of mind of doing that on an ongoing basis multiple times a day. And if, by the way, you should get coronavirus on your hands, on your fingers, it's not going to kill you. It does nothing there. The problem is when you bring it to your face, right? So remember, if you're going to touch your face, you have to sanitize your hands. And we want to do that multiple times a day, especially for those who are still in the workforce for whatever reason they have to be there. Maybe those people who are not doing self-isolation or social isolation at home. So we've talked about mask disinfection. We've talked about the importance of not wearing gloves in public unless in very rare situations when you're in patient contact. Here's one time when you should definitely have 2 grocery bags on your hands. And that's when you're pushing a cart at the supermarket because you don't know who's touched that bar. You might work on sanitizing the bar, but that's quite a bit of use of your sanitizer. But it's probably best if you use your bags when you are pushing your grocery cart. Then, if you have to reach for an object, you take your other hand, assuming you're right-handed, I'm using my left hand, you pull the bag off your hand, you grab whatever product you're going to use from the shelf, and you put it in your cart, and then you put your hand back in the bag, and you keep pushing. There's something else I want to tell you. What is the likelihood that you're going to bring coronavirus in from a package from the store? It's probably nil. If you go to who.int, World Health Organization.int, International, World Health Organization International, you don't have to spell out the international, it's just INT. There's a very useful place there for coronavirus 19 information, and there's something called Myths Busted. And you can go down there, and that's one of the things that they mention. I don't agree with everything that the WHO says, but I certainly agree with that particular recommendation and many others that they make. So remember, coronavirus.gov and who.int if you want more information, and there are many reliable websites, including the New England Journal of Medicine and the CDC's website. In closing, let me remind you that we're going to come back real soon with another very interesting video. I'm going to review some statements from the New England Journal of Medicine that have to do with comparing this coronavirus outbreak with the flu. Who could have figured? Go back to our first video. We talked about this more than a month ago, and now it's coming back. So we'll see what reputable people are comparing this to a flu epidemic. Very interesting talk. We're going to come back and talk to you about that soon. Remember, give us a thumbs up if you like us. Subscribe. If you subscribe, I know that you're interested. I know that you're going to get these chats pretty much as soon as I post them. So if you like the program, subscribe and tell your friends about us. And that's how we stay together in community. Thanks for listening. We'll be back soon.